Unfortunately, I lost my father when I was 10 years of age, but he wanted me to become a big doctor. So after doing my 12th, it was not just to become a doctor, but to fulfill his dream. It was a passion.
Our guest today is Dr. Pooja Nandwani. When did you first realize that you wanted to be an oncologist or even anything in the medical field? When did you realize, and what made you feel this way? What inspired you to take up this profession?
So I would say there was no such day when I really wanted to become an oncologist. It was really by a chance incident, for the reason that I did my MBBS from Surat. After finishing my MBBS, when I came to Ahmedabad, I got this MD Radiation Oncology branch. So I'm talking about a scenario 2 decades before, where we were not very conversant with the oncology field, because in our MBBS time we don't have that much exposure in the oncology training. So in a Surat city, where in the new civil hospital campus, the oncology is a separate building. We don't get any time to go there in our MBBS tenure. So for me, oncology was entirely a different branch. So I got this MD Radiation Oncology in Ahmedabad, and I thought, I'm not sure whether I should go for it or not. Let me have a look at the department. So I went to the place where I did my MD, Gujarat Cancer Research Institute, the Department of Radiation Oncology. And to my utter surprise, in the mid-afternoon, the department was fully loaded with patients, around 100 patients sitting in the waiting area. And I was impressed. I said, wow, cancer, is there so much of volume of patients we see in the oncology, and that too in the afternoon? 100 patients, I was like, oh my God. Then, and at that time also, a situation I'm talking about 2 decades before, our radiation department was very systematic. There were head and neck OPD, site-wise we were doing. There was head and neck OPD, there was brain tumor, there was gynec tumors. So I had a chance to sit for a few minutes in each of these OPDs, and I saw that it was a absolute clinical branch which I really aimed and dreamt for, that I want to become a clinical person. I was very impressed with the way the consultants were talking to the patients, talking about their physical problem, talking about their mental things, because being cancer patient, always they have a lot of other different problems, physical problems, mental problems, social stigma. They have so many of queries and myths in their mind, so much of stress where they have, and the consultants were doing a fabulous job while talking to them. So I was very impressed. Then I had a look at the machine and I said, wow, such big machine, more bigger than the CT scan, so fancier. So I thought, yes, this is the branch I think I should go for. So yes, not by choice, but by a chance.
Medical studies, whether it is MBBS or MD, it's infamous for being very long, very difficult. Lot of hours are spent in all of this. So tell us a little bit about your days when you were studying medicine.
I agree to that. It's a time-consuming process, I remember when I finished my MD, I tried to call a few of my school friends, trying to see what's going on with them. And I realized they are pretty much settled in their professional career. Somebody has become a CA, somebody has become an engineer. They're well settled in a good company. Somebody is running their parent business. They're personally also well settled. They have married. They've got married, they have kids going to the nursery school, and I was like just finished an MD and just married, no progress. So I thought, oh my God, it's a time-consuming process, of course. But I would say the journey was more beautiful than the destination. The MBBS tenure, the MD tenure was a wonderful experience. I did my MBBS, as I said, from Surat, Government Medical College, Surat. So that's a beautiful college with a lot of volume of patients experience what we go through. A beautiful city. That was the first time I stepped out of my house, because I finished my 12th and I was moving from one city, Ahmedabad, from my hometown to another city. So I think that made me more brave, more strong. And I got the opportunity to meet different people, somebody coming from Delhi, somebody coming from South. So it was a wonderful experience mingling with other students. MBBS was perfect. I think it was a wonderful journey for me. I met my husband and my MBBS journey because it was love marriage. My husband is 3 years senior to me. So I remember he did my ragging, and now I am ragging him for the rest of his life. And then I came to MD, to Ahmedabad for the MD Radiation Oncology. Again, it was back to my hometown. So this thing, but yes, the branch was superb. The experience was superb, going through a field of oncology where I had no experience, starting from zero. Then I realized how this branch oncology is it's so fascinating, so challenging. At the end of the day, when you're able to get the smile on the patient's face, that is the most rewarding thing you really aim for. And then you feel proud that you are a doctor and you are making difference in somebody's lives. If you know about Surat, people say in Gujarati, there is a saying which says, Surat nu jamar ane Kashi nu maran. Matlab, eat in Surat and die in Kashi. If you have a good supportive family, so that really makes you go through your professional front very easily.
For you, they are patients. For them, you are like pretty much next to God. But sometimes oncologists, doctors also happen to form an emotional bond with certain patients. How does it feel then when you're treating a patient, and sometimes when you know the prognosis is not very good, or sometimes when you lose patient, then what is it you go through? How does that feel?
Days cannot be very good and gloomy every time. There are dull days also when I see that the patient has not responded and I'm losing my patient. I would just brief one patient. I have just joined a new corporate sector this year beginning January 2020. And when I joined, just maybe after my 2 weeks of joining, I saw I would say a young patient. He was 80 years old. Age is just a number, but he was absolutely very young by mind, and he had carcinoma of esophagus, a very advanced lesion, and the surgeon was not able to operate on him. So as a multidisciplinary tumor board, we decided that we'll be having we'll go for an attempt of concurrent chemo radiation curative approach. Of course, it was a big lesion at the esophagus, but we did curative radiation in that patient with concurrent chemotherapy. And I still remember the smile on my patient's face when he used to come. He was so jovial in nature. When the day we started his radiation, he completed his 80 years. So we had celebrated his birthday in our department. It was such a joyful moment for everyone. The patient also felt very happy. He had a very good sense of humor. I remember at that time, Donald Trump was here for his visit in India. When we celebrated his birthday, he said, I asked Trump not to come here for my birthday, but still he's coming. I can't help it. So he was such a brilliant sense of humor. So I was to always think, young man, 80-year man, such a with brave heart, and I do the best for him. But despite the best radiation, despite the best chemotherapy, we ultimately lost him. After the radiation was done, 6 months later, we did a PET CT, and unfortunately, he didn't have any local disease, but he had widespread lung metastasis, and unfortunately, we lost him. So that was a very bad feeling when you have a patient like that who is full of life, who is so energetic. Age is nothing for him. Still, he very bravely completed the radiation therapy, and we did the best, but unfortunately we lost to the biology of the tumor. So that sometimes feels really bad at some moment of time. But one interesting fact I would learn from that patient was when I informed the surgeon that unfortunately we lost him. The surgeon replied me a very beautiful thing. He said, Pooja, no matter we do the best for the patient, but these type of experiences and these type of results always keeps us humble and keep our learning graph going on. Yes, I would have wished he could have lived more, but I'm grateful that I was a part of his journey. And I remember when he was no more, but his family made a wonderful video, 5 minutes video, and he in that video they had 2 pictures of mine also. So that made me very touchy. That the family really remembers me now also. So it was a difficult phase for all of us. For all of us.
I want to ask you, so you have so many years of experience, you've done so much work, so many patients, so many awards. I have seen a huge list of your publications, research awards. So when you look forward, what more do you think of in future? What are your goals? What do you look forward to?
Oncology is a very rapidly growing, branch where everything is changing so fast. If you talk about chemotherapy, we started from chemotherapy. Now we have come to targeted. Now it is immunotherapy. There is gene therapy. There's so much of advancements happening in the field of oncology. So is in my field of radiation oncology, where we started initially with simple machines like Cobalt, but now we have so fancier machines, the newer linear accelerators, with so many of conformal techniques into them, making the treatment more precise and accurate. So I always wish that these all advancements, we can offer a best modality of treatment to the patient. And nowadays the concept of multidisciplinary tumor board has come, where in a particular meeting, we have everyone in one place. A medical oncologist, a surgical oncologist, a radiation oncologist, a radiologist, a pathologist, and all the staff members. And then we sit down together to decide the best plan, individualized plan for every patient, so as to get the best treatment design for the patient. So I think these all type of things and processes are eventually in a process to make the patient get rid of the disease and with the good quality of life. So I always keep learning as I said, of this recent patient whom I unfortunately lost despite all best attempts. But something from him I learned, and I want to keep on going with this learning graph with me and give more and more better results to my patients.
So one last thing I want to ask you. So when we put this interview out, there will be some young persons, girls and boys, who want to be an oncologist in the future. So they're looking at you with stars in their eyes saying, I want to be her. So what is your message to them? What would you like to tell them?
So I would say, look at my own experience. It was not a by choice decision, but still I'm so glad that I'm in a wonderful profession, especially being an oncologist, where there are so many things going on parallelly. The field of oncology is itself so much changing day by day. It's so much challenging day by day. Look at the perspective of the patient. For him, when you say him that you have cancer, it is like a death sentence for him. A situation I'm talking about few years before, where there was not much advancement in the technology. But today, in this era where you see there's so much of advances in all fraternities, like in surgery or in medical or in my field of radiation, where the technology and the advances are so huge that now we can give a better survival rates to the patient, and we can give a better quality of life, and we can make a remarkable difference in their life. It is really rewarding when you see that, when you treat a very fatal disease known as cancer, and you make an impression in patients' mind, in their families. Like I said about this patient, despite I lost him, but the family still remembers me. In their 5-minute video, they made it a point to put down my 2 pictures into that. So I think it's a brilliant field. Now the scenario has changed like anything. It is not a disease where the results are dismal. It is a disease where still we can improve the survival rates. We can give a good quality of life to the patients. And if you are ready for challenges, if you are ready for changes, I think oncology is the branch for you, and you should go for it.
Subscribe to our channel and press the bell icon for more videos on cancer care.